For years and years I did management, and then back in 13, 14, went back to truck driving, so then I'd done it in my early 20s. And truck driving took its toll on my body. And I had some knee issues before, and that truck driving, getting in and out, and some of the work I had to do with it, threw them further into deterioration than what they were going to go. It hurried it up a little bit. Got on Medicaid, and I was like, great, at least I have something, you know. And they took care of me, they did. I filed for disability, and when I got the amount of income they were going to give me a month, it was $14 too much a month for me to keep the Medicaid. And I knew there was a 6-month period that I wasn't going to have any kind of medical. The only insurance I could find would have maybe covered a little hospitalization, wouldn't have covered any medication, would have covered no doctor visits, you know, as far as co-pays. Nothing like that. It just, if I got in the hospital, you know, it would take care of that. That's not going to help me, you know. Need to be real careful and not get sick. Try not to get sick, you know, and I just get medications that I absolutely knew I had to have, and the ones, you know, that weren't as, well, I guess, important to me being okay, I guess maybe lay off them, you know, if I could afford them, but get the most important ones. You know, I didn't see any other options. I don't have kind of money, you know, your doctors want a lot of money just to come see them, especially if you don't have insurance. And I was just kind of crossing my fingers and hoping I'd make it to May. Because if you just can't do anything or go anywhere, you know, you can't move forward because of your physical ability or disabilities. It's really hard, you know, to keep a stiff upper lip.
I am from Louisiana, born and raised in Louisiana. I left and went to California. I lived there 24 years. My mom got sick and my father, so I moved back home. Then my body started failing. They told me I had to go on dialysis. I was in denial. And then I ended up, you know, needing help to pay for my medication because I no longer work and I'm on disability now. See, Medicaid denied me, so I can't get Medicaid.
Current estimates are that about 15% of Louisiana residents in general and about 15% of residents of Northwest Louisiana have no Medicare, no Medicaid, no private insurance, and finally do not qualify under state guidelines for free care. So that's a significant amount of the population.
Well, Caddo Parish has a large diabetic community, and it also has a large community that smokes, which causes other health problems.
According to data from Northwest Louisiana, there's between 40 and 45,000 uninsured adults in our area, and we suspect that many of them struggle with chronic conditions.
People legitimately cannot afford to get their medications filled. It's not that they're deciding to do one thing over another. They cannot afford to get their medications filled. If they did, they wouldn't eat.
The medicine is so high. I'm telling you, that one pill that I take is $200. And I know the insulin was like $400 or $500 just to have those 4 pens.
For my Humalog, which is the one I take after every meal, just one bottle of it for a month is $200. And the one I take before I go to sleep, the Lantus, just for that one bottle for a month, Also, I think it's like $185 just for that one.
My whole attitude now is, hey, I got it, got to deal with it.
Healthcare now!
I think that I've heard some misconceptions over the years, especially with different laws that are enacted. Is first it was everybody's insured, or now that we've expanded Medicaid, everybody who wasn't insured is on Medicaid. And I think that that's something that the general public needs to know, is that there's always going to be somebody who is either falling through the cracks for some reason or just needs some temporary help.
Medicaid expanded in Louisiana a few years ago, and a lot of people were then covered by Medicaid. But just because you have Medicaid coverage doesn't mean you have a doctor that will actually accept that Medicaid. There have been a lot of people who've come onto the Medicaid system but still have no access to a doctor.
So there are a lot of things contributing to our current healthcare situation. One, I think there's just a lack of understanding of what it is that people need.
I go to 4 or 5 different clinics for my epilepsy, and I take a lot of different medicines for it. I was born with it. I'd have seizures. My mother used to take care of me, but it went away for a while, for a few years, and then it came back. I'm paying bills all over town.
I think that the healthcare industry as a whole needs to value people's time, and they don't. They try to fit everybody in to the same pegs, you know, to work the way they operate instead of what people need.
How could this be fixed, our current situation? Instead of levels of hierarchy and, interprofessional bickering, we really need some trans-professional education and to see ourselves as the healthcare team and how to make this process better. I think that's huge, like us becoming a healthcare team like it's meant to be. That has to happen for us to be able to deliver affordable care.
Most people do not realize that the human voice and human touch are medicine. That's a form of medicine that we don't think about as much as we should, but human touch and the voice are very, very important in making people feel better.
Fill that out, top part, sign. Most of them are signatures. There is one page, though, that has some information, okay? And then I'm going to get a copy of your ID.
There's not really a typical day. We know we have 10 to 12 clinics a month, and every day is different. And so if it's clinic day, there are patients and students and medical providers running around. There are cooking demonstrations going on. Sometimes there's exercise classes going on.
Hi, I'm Dr.
The center does things that are different as far as patient care is concerned, especially when you're dealing with an illness that's chronic and you're low income. You don't have the funds necessarily to do the things that you want to do as far as taking care of your health. When somebody can say a kind and soothing word and somebody reaches out and puts their hand on your hand and touches you, that in itself can give you the hope that you need. And not only that hope, but it also gives you that feeling that somebody cares for you.
They'll treat you, they'll take care of medication, and I mean, literally just, they provide it.
They're helping people get a healthy lifestyle. They're out there fighting the battle, trying to make people healthy and prevent the healthcare problems that we see in people.
MLK is the oldest free clinic and free pharmacy in Northwest Louisiana that provides comprehensive primary care to the uninsured who struggle with chronic conditions. And our name comes from the philosophy of Dr. King and the beloved community. He believed in a community where people met each other where they were, and that they gave love freely, and that they didn't distinguish between worthy and unworthy. And that was a core value for our founders in the way that they wanted us to approach healthcare.
Dr. Jackson and other people started coming together to help people with problems that they had, chronic illnesses, finding medication for them and everything. You could honestly say they were the Good Samaritans. They were the Good Samaritans. They were there to help people regardless of who they were.
One of the things I noted was time and time again, we would see patients come into the emergency room with devastating complications of very common and usually fairly easy to treat conditions like high blood pressure. You know, at LSU, we provided free medical care to a lot of these people. But once they left the doors of LSU, they couldn't get their medicines. It didn't make sense to me that we would provide all this high-tech care and not the simple, everyday, low-tech, 50 cent a day worth of high blood pressure medicine that would prevent things like strokes. And in '85, the year I was chief resident, my father suggested I go talk to Sister Margaret McCaffrey about that. Things didn't seem to percolate a lot with Sister Margaret. She very quickly decided that I was going to start seeing patients across a dining room table at the hospitality house, and within our second meeting we had set a date to begin. So in November of '85, I started seeing patients in the dining room of Sister Margaret's soup kitchen. We didn't have a whole lot of community support for about the first 6 or 8 months. It just took time, persistence, and the goodwill of Sister Margaret, frankly, to earn the trust of the community. Once that happened, we had more business than we could handle. 3 or 4 years later, we broke ground for a new clinic building across the street, and it was at this time that we began to get more and more volunteers. Now we average somewhere close to 2,000 different individual patients per year.
When I first came to MLK, the majority of our patients were older people. But then over the years, I saw a gradual change in our patient base, whereas if you look at health statistics over the years, more and more people at a younger age were developing chronic illness. Louisiana does not have good health statistics. A lot of the southern states do not. So here we have a whole new population of people coming into the clinic who are a lot younger, developing chronic illnesses earlier. So our patient base started changing.
I moved here to Louisiana in 2010 after I graduated from high school. I was just working a regular employee at a clothing store. No health insurance, no Medicaid. I didn't have anything at that time being. I was 18. I started feeling bad, like my legs would hurt every morning. I didn't think nothing of it until I finally went to the hospital, and at first they thought nothing of it and they were just gonna release me till the nurse, she came running back in and she said, "Has anyone ever told you that you had diabetes?" And that's when they diagnosed and said, "Yeah, you're type 1 diabetic." Oh, I was shocked. How can I explain it? Like disbelief almost, like in denial. I just wouldn't believe it, and then depressed for a little bit. I was just upset. Once I got diagnosed, I started coming here. I would be out easy at least $800 or $900 a month. Before I started coming here, I had to pay for my medicine twice, and I know if it wasn't for here, I wouldn't be able to really afford it all the time. Like I'll have to miss taking my test. I wouldn't be able to test 3 or 4 times a day, maybe just once or twice a day at the most I would be able to test. And maybe only take my medicine like once a day instead of 2 or 3 times a day.
a lot of times people wonder why people are going to the emergency room for primary care. And one of the reasons could be because they don't have the right kind of access at the right time. If you've got somebody who is 35 years old and they're a construction worker, and during good weather, they're going to work 7 days a week, when are they going to go to the doctor? You know, they got a family to feed at home. They're going to stay on the job and they're going to just show up in the emergency room at night. Because even if somebody is insured, if they have a Medicaid or Medicare or a private insurance card, if they can't access care when they need it, they're still going to be in the emergency room. Because if they can't afford to miss work, that's groceries for their family, they're going to stay on the job.
I was having real bad headaches at work. I work at a call center. We didn't have health insurance there. I had no way to pay for a doctor to see me and stuff, so I was just going untreated. It probably had been at least a good, I would say, about 7, 8 years, because the last time I really seen a doctor was when I was pregnant with my son. As far as that, if I had an accident or something, I'd show up, you know, at the emergency room, or just really sick, show up at the emergency room and then have to get those bills in and trying to pay a little here and a little there, and that's about it. I was in a very dangerous part in my life with my health, and they've helped me get back on track. They helped me with my diet and stuff, teaching me things. I believe if I hadn't have got treated by them, that I possibly would have had a stroke by now or a heart attack.
I think a lot of people thought that the typical free clinic is some dark, dank place that somebody's going to come and, you know, they don't have the latest equipment and it's not a very happy place, and that it's the typical patient who may be hard on their luck, maybe haven't tried to help themselves. But I think over the years people realize that we have professional people that just need help once in a while. You know, you don't know. It might be your next door neighbor that needs some help one time.
I think sometimes our students have just a very narrow perspective of what a patient is or where a patient comes from, and that perspective is generally skewed by their own life experience. And so coming to MLK and having their minds expanded, which is actually education, has helped them to be better nurse practitioners, but better nurses, better people. You know, that's been key.
That middle one over there.
Okay.
Two, I think it is.
Okay, stick it as when you back up.
I was diagnosed about 10 years ago. Totally shocked when I got the diagnosis. I had just gone in for a regular checkup with my gynecologist, and he called me back and he said, I think we need to check your blood sugar again, or your blood again. So I went back in and I thought it was just something odd that happened. And then he called and he said, yeah, I think you have a little type 2 diabetes going on. And I just was pretty much in denial, and I think I've kind of operated that way for a long time, thinking, I can't be diabetic. I can eat this and get by with it. They reached out to me and they said, would you be interested in coming to one of our diabetic education classes? And I thought, what did I have to lose? I mean, it was just more education. I had never been here. I just assumed it was only for people that did not have insurance. I didn't realize that it would be an option that I could come and I could get information, or I could attend the classes. So I signed up and I came to the class, and that's how I was really introduced to what classes go on here and some of the different activities. I still know I have a long way to go and a lot more to learn. That's why I think any education is helpful. I think you can always learn.
Frankly, what we've turned into has really surprised me. I mean, I can't say that I ever had any grand plan about what was going on. I just saw something that I thought didn't make sense to me, and I wanted to do what I could to address it, and that's it. What has happened over the years has been amazing to me.
Are they so new? Are you working with them?
They're,
Our model is built on relationships. MLK is a place of hope. It's a place where people can come and share their story, and their stories are heard and their stories are honored. And that trust that comes from being authentic with your story and the space to tell your story and know that your story will be believed and trusted tears down a lot of walls and allows people to let their true self shine through.
People know each other and they see the same provider. It's not like they're coming in to see a different person all the time. They don't have to tell their whole story over and over again, whereas some clinics they do. Somebody feels valued, they come in, we know them by name, they come and see their doctor here or nurse practitioner, who's ever the provider that day. They know their story and they don't have to, it's like they have a bond already. So we not only value their time, but we value them. And that makes a big difference, and I think that is why, another reason why we probably have a 95 to 100% show up rate of our appointments, which is, when I tell people that, they're just astounded.
It's very interesting. It's very, very interesting what they do here at the center and how many people they help. And not only the help that they give to the people, but they're a lifesaver to the community.
There are people here in our community today that would not be here if it wasn't for MLK, if it wasn't for the team of medical providers caring for them, or a free pharmacy giving them access to life-saving medications.
The patients I hear all the time, thank you. Sometimes the simplest thing is, you listen to me. Where I came before, nobody listened to me. Now you listen to me.
A lot of us without this clinic, we wouldn't be here for our families, and for a lot of us, it means a door open that we thought was closed.
A gentleman came to us and he was retired, and he and his wife had Medicare. They were fully covered and it worked for them. And then his wife became very ill, and her medications went from 1 to 2 a month to about 6. And on their fixed income, he couldn't afford her 6 medications to keep her alive, and then his insulin because he was diabetic. So to care for his bride, to care for the woman that he had loved for 40 plus years, he decided to just stop taking his insulin altogether. By the time he was referred to MLK, his blood sugar was over 600, and that is a critical number for diabetics. And so we were able to get him emergency medications, and then we were able to get him plugged into critical care. But he wouldn't have made it too much longer after that with his blood sugar being that high.
One of our long-term patients who also did foster care, and she had a baby that had fetal alcohol syndrome, and she was bringing him into the clinic every time that she came. Over the years, she was coming for a long period of time. We saw that baby, growing, and she ended up adopting him. And then she became eligible for Medicaid herself. And at that point, we helped her find a Medicaid provider. She actually cried when she did not want to leave. And she was one of the ones that said, "You actually listened to me." And to me, that was a pretty neat time that she came.
We fairly early on developed a screening mammography program. And one clinic, I had a lady come in and she said, I don't need to see you as a patient today. I just wanted to tell you thank you because y'all found my breast mass, and they cured my cancer.
This is the oasis of health. And this oasis of health is in this desert. And people come to this oasis, whoever they may be, to get nourishment, to rest, to recuperate, and to feel good about themselves. And I think in the process, those people that come, that receive the services that are afforded here, they in turn go out and tell other people. And when they tell other people, that reinforces what this center is all about.
There are people out there who are working hard and doing the best that they can, but sometimes it's still just not enough. And if it wasn't for our clinic, there would be no place for our population of patients to go.
There's so much disconnect in the world today that this makes them feel connected. So I think as a community, that's huge. And it's huge for patients who've never had a connection to anything healthcare related before.
If you need help, you need help. Doesn't matter what class you're in or what class you were in or gonna be in. You know, if you need help, you need help.
It's been rewarding to see what we've been able to do. From one employee to where we are now, to, you know, a box on the floor with a few bags of medications from a pharmaceutical company to a whole pharmacy with $2 million worth of meds coming in here every year on behalf of patients. So I think the biggest reward to me has been seeing it grow.
It means a lot to me because, again, without it, there will be a lot of people here in the Shreveport-Bossier area not knowing what they'll have to do or how they're gonna make ends meet. Like, without this place, I don't know where I would actually be. I have no other place except for here, unless I'm paying for everything out of pocket myself.
They took care of me. I didn't have to worry about not taking a needed medicine because they had it, you know, and I was shocked, just in shock, you know, that somebody would do that for us.
Well, it's meant a lot to me because the medication that I take, I know I wouldn't be able to afford it without help from, you know, from them. So it has been a blessing for me, and I thank God that they help, you know. Other than that, I don't know what I would do. I really don't.
I love it when I get to come to work and I see patients become advocates for other patients. I love it when patients come and they're enjoying the cooking demonstrations and they're taking extra copies of the recipes because they want to take it back to work and they want to give it to their coworkers, and they want their coworkers to start eating healthier because they've seen the effects that their new diet has had on their health and their overall happiness and what it's done for their family.
There's a lot of people like me. We might not be here for our children or our husbands or be able to wake up in the morning without them.
It's not just a building where people come and volunteer, or patients come to see a provider. It's just a completely different atmosphere from the typical. It's a culture and a family of its own. You know, it's our own little special place, I guess.
All I know is whatever service this place has offered to our individual patients in the community has been repaid back to me personally 100 times.